If perhaps you have previously tried artificial insemination and it hasn't worked, or perhaps there are some underlying fertility issues, you may want to go for IVF to try for the baby. In an IVF cycle, the woman who has chosen to be the mother will have to undergo ovarian stimulation with larger hormone doses than for artificial insemination. This is because we need more eggs to mature. You will be given the hormone medication by your doctor, taken according to your instructions, and the development of the eggs will be monitored by ultrasound. When the oocytes, the eggs, are ready, you will undergo what is called follicular puncture. Follicular puncture does take place under mild sedation or mild anesthesia. It's also called ovum pickup, in a simple procedure where your eggs are removed from your ovaries. These eggs will then be taken to the IVF laboratory, where they will undergo the in vitro fertilization. The previously prepared sperm from your donor will then be mixed with the egg cells, either using a technique called ICSI or regular IVF. And the resulting fertilized eggs will then be allowed to develop in the laboratory. These embryos, when they are ready, will then be transferred into the uterus of the woman. The woman will previously have to prepare her endometrium, so more hormonal medication to make sure that the lining of the uterus is ready to receive those embryos. Embryo transfer will occur, and hopefully implantation, again, the 2-week wait following the embryo transfer until you can take your pregnancy test to see if the treatment has been successful. When one woman in a lesbian partnership undergoes IVF, you may want both women to sign the consent forms to make sure that they are both included as the legal mothers.